There's been a sharp increase in the number of people with Middle East respiratory syndrome in Saudi Arabia. The disease kills about 1 in 3 patients. Healthcare workers around the world are watching closely. Should people be worried? This is Inside Story. Hello and welcome to the program. I'm Mike Hanna. There's no cure and it's spreading. Middle East respiratory syndrome, or MERS, has killed more than 100 people since it was first discovered in 2012. On Sunday, another 10 patients were reported in Saudi Arabia, raising concerns across the region. Tarek Baisley explains.
Middle East respiratory syndrome, or MERS as it's become known, is a so-called coronavirus from the same family as the flu. It causes coughing, fever and pneumonia, and in just over a third of reported cases it's caused death, often in the elderly or people who are already sick. It was first reported in 2012, and until 2 weeks ago, around 200 cases had been identified, most of them in Saudi Arabia and other Gulf countries. But in the last 2 weeks, Saudi Arabia has reported more than 100 new cases, 10 just on Sunday, including 2 deaths. There's also been the first recorded case in Egypt.
The patient arrived from Saudi Arabia with corona disease. He underwent the necessary analysis quickly, and the infection was confirmed. The most important thing is to prevent the spread of the infection and to put him under supervision in isolation to take the necessary medication.
Some doctors say the increase in reported cases could be the result of mutations in the virus. These would allow MERS to pass more easily from human to human. But an initial study of the virus's DNA doesn't appear to support this. Instead, the Saudi government says the increase is because it's testing more people, many with milder symptoms. The MERS virus is known to exist in camels, but not all people who have caught the virus have been in contact with the animals. Many camels in Saudi give birth in April and May, and some experts suggest this might result in an increase in viral activity. Well, the Saudi government's invited 5 international vaccine makers to the kingdom to work with it on a vaccine. But some health experts suggest the money would be better spent on identifying and stopping the virus before it's transmitted to humans.
Well, the virus has been most prevalent in Saudi Arabia, where more than 100 infected patients have died. Cases have also been reported in Qatar and the United Arab Emirates. This is a major concern because Doha, Bahrain and Dubai have busy international airports. Jordan and Tunisia have also reported cases of MERS, and in recent days, Egypt has also reported its first case. For more on this, let's bring in our panel. Here in Doha, we are joined by Dr. Mohammed Al Hajri, Manager of Health Protection and Communicable Diseases at the Supreme Council of Health. In Washington, Dr. Daniel Lucey, Adjunct Professor of Microbiology and Immunology at Georgetown University Medical Center. And in London, Dr. Ben Neuman, a virologist at the University of Reading, who studied coronaviruses for 17 years. Welcome to you, doctors all. Let's begin in Washington, D.C. A novel virus, Dr. Lucey, named less than a year ago. How much is known about it, or rather, how little?
Well, sir, I would say that quite a bit is known, but not enough. And so internationally, and particularly in the Middle East, in concert with World Health Organization, a lot of research, clinical, epidemiological, and virological has been going on and is going on as we speak.
Well, Dr. Al Hajri, clearly a great concern here in the region in particular.
Yes, but we need to be balanced in our approach from the public health perspectives, where we need control measures to stop the spread of the infection, to identify the source, and also to support the international collaboration to do some research to try to identify the characteristics of this virus, and also the transmission, the chain of the transmission between human and possible animals or from the environment to help us in this approach.
Well, Dr. Ben Neuman, this question of actually establishing what the virus is certainly critical, of course, in its treatment, is it not?
Absolutely. I think the interesting thing about this virus is that it has a long history in camels. There are people who have gone back to camel blood samples from 10 years ago, and still they find evidence of this. So the virus has been around for a long time, but it's only recently started to cross over into humans, and that's the part we don't understand about MERS.
Well, Dr. Lucey, the fact that it's been around for a while, but now all of a sudden it is infecting humans. Why the change? Why the leap? Is there any known reason as yet?
Again, there's a lot of research going on, appropriately so, to try to answer this question, but we don't have the definitive answer yet. I would say that in general, in new infectious diseases like the MERS coronavirus or the SARS coronavirus in 2002 and 2003 in China, or the Nipah virus in Malaysia in 1998, first appear in the human population, it's good to have an integrated, what we call One Health approach, meaning studying the people, animals, and the environment to understand why did these diseases appear, when and where they did. And that's what's being done now for MERS.
Well, Dr. Al Hajri, clearly there is a geophysical correlation to this virus, the fact that it is occurring in a specific geographical region at this particular point. But how important is it to establish the source of the virus be able to start countering it, or perhaps at some stage even finding a vaccine?
The issue is that we have identified the Mers-CoV in humans first, and from here we start and try to trace the contacts with the human, and we succeeded now to identify this virus in camels, at least, and we are still searching for other sources or maybe other animals that might be involved. The most important thing is that with new emerging diseases, we need to be open-minded and think about all possibilities and not stick with one hypothesis or theory. So at the moment, humans and camels have been proven to be affected, and now we need to take measures here. But research must continue to try to find other sources from animals or even in the environment about this issue, basically.
Ben Neuman, this is like a detective story, essentially. What you are doing and what immunologists are doing is actually tracking something, trying to find out from all different perspectives. As we heard from Dr. Al Hajri, you cannot take anything for granted. You cannot accept any givens in this type of research, correct?
Absolutely. Coronaviruses are strange, and this one is particularly so. So there's evidence that before the virus gets into camels, it's found in bats. The strange thing is that it's found in bats in South Africa, all the way to the Netherlands, and these bats range all the way over Asia. Yet, for some reason, it only seems to transmit to people in the Middle East. So there's clearly some missing piece of this puzzle. It may be camels, but a very few cases have actually been traced definitively back to camels. There may be something else out there.
Well, Dr. Lucey, I mean, one of the things that was not widely known is that many of the camels in this particular region are imported from Australia, of all places, a vast majority, in fact, of camels, yet no sign of the virus in Australia itself. So clearly, once again, we are going back to some geographical factor, it would appear, that actually causes this virus to jump into human beings.
I think that's quite a reasonable hypothesis. At the same time, I would caution that the testing for this MERS coronavirus, whether in camels or people or bats or any other species, has been done primarily in countries in the Middle East, such as KSA and UAE and Qatar. And so I think it's prudent to reserve judgment as to whether or not the virus may not be found in some other countries, whether in Africa or in Australia or as Dr. Ben mentioned, in other parts of the world. So again, the research is ongoing and we don't have the full picture. And as Dr. Mohammed Al Hajri said, I agree, we need to keep an open mind from a scientific point of view.
I mean, Dr. Al Hajri, that the Saudi Arabia has said, for example, that one of the possible reasons for this increase in incidence is that they are testing more widely. In other words, that the disease itself may not be increasing, but the fact that they are spreading the depth, the width of their testing procedures would account for the sudden increase in incidence of the virus.
That might be one of the factors for the increasing numbers or reported cases. Because since the beginning of this disease, we were in the Gulf affected first, so we need to take measures and try to screen and test more than other countries. And that may be why we have discovered more cases. The statistics now with the WHO indicates that number one country in the numbers of tests being done is Saudi Arabia, followed by Qatar. Because we care about our people, we try to screen and confirm each suspected case of Mers-CoV, whether it is Mers-CoV or others like influenza or other influenza-like illnesses. And that will, with time, yield more positive cases with time. And basically, with time, with more investigations or screening, we will find even more mild the cases as primary or secondary cases as a result of increasing and distributing and increasing this number of tests. So this is one possible explanation, but there are other explanations in terms from where we get it, and sometimes are there multiple environmental sources of this infection. Is it only camels, or there may be other vectors like bats or rodents? We need to be aware of that.
Dr. Neuman, we had the reference to influenza. We've got a situation here where in order to know that the virus is present, obviously there has to be testing. How does this complicate the situation where you do not necessarily know what particular branch of the virus a person, a human being might have at where the symptoms being displayed may be easily confused with other more prevalent viruses?
This is definitely a complicating factor, and this is similar to something that we saw with the SARS outbreak about a decade ago. So there have actually been 4 distinct genetic waves of MERS virus washing over the human population, and the first 3 have now gone extinct. It's the 4th wave that's infecting people now. The virus seems to be changing, and as it changes, it seems to be getting more adapted to people, so it's less deadly in people and is possibly able to spread a little bit more widely.
Well, we heard their reference to another virus. MERS is not the first virus to cause this sort of concern. The SARS virus that we heard mentioned broke out in Asia in 2003. More than 8,000 people are thought to have been infected. More than 700 died. And during 2009 and 2010, swine flu, or H1N1, was responsible for a pandemic, but it was a serious threat only to people who already had pre-existing health conditions. Dr. Lucey, obviously the viruses are different, but in terms of the public response to SARS when it occurred, it's far less response at this particular stage with the origins of MERS in terms of its impact internationally and certainly even in the regions where it's occurring.
Yes, sir, if I understood your question correctly, the SARS virus emerged and spread very quickly from the end of 2002 in Guangdong province in southeast China, then to Hong Kong, and then towards the end of February of 2003 to Canada, to Singapore, Hanoi, Beijing, mainland China. So far, the MERS coronavirus has not been that contagious or transmitted that widely or infected as many people as quickly as its cousin, the SARS coronavirus, did just over 10 years ago.
But Dr. Neuman, is there perhaps something that helps those following this trail, the fact that it does not appear to be spreading as widely as its cousin, as was said, did a few years ago?
This could help, and most of the way that we look for signs of infection is by looking in the blood of people. And in your blood, you'll preserve traces of a previous infection called antibodies, and these can last for years, even for life. So by testing people and looking for these old signs of infection, we can find out even years later if a person has been infected, and eventually it's a good sign that we'll be able to trace back the origin of this current outbreak.
Dr. Al Hajri, we must be very careful not to be alarmist about this. The CDC, for example, Center for Diseases Control in Atlanta, ranks it as a level 1 virus. In other words, it's watch. There's no travel warnings. They are just warnings to people to wash their hands, to be careful about what they ingest. How much of a threat is it at this particular stage to people within the region? And of course, remembering, for example, the airport terminals, the many hubs that we've got in the region, how much threat is it further afield as well?
To produce a recommendation for such a virus internationally, it needs many scientists, led with WHO and other recognized centers, to bring all the evidence so far, and also after that to review it with regular intervals according to the findings of new research. So initially we said it's a human disease. We thought about the environment and the animals. Now we moved a little bit to the camels. Now we have new recommendations in dealing with animals, particularly camels. You need to practice all the hand washings and be careful not to deal with sick animals. Boiling their milk and avoiding them, particularly for people with pre-existing medical conditions. So we are trying to understand this disease with time. And as more research are becoming available, we will have more information to analyze and discuss together as a panel of experts to come with some balanced recommendation, not to create panic or give more than needed in terms of reassurance. And here in Qatar, we will have by the end of May, 26th of May, with the NIH, National Institute of Health of the United States, a meeting for 3 days with about 100 scientists. We'll bring all the updates from all the researches done so far, plus other diseases, viral diseases, to evaluate and also to encourage more research to be done, because we have the virus in our region and the expertise is all over the world. We need to collaborate to find some results and answers for this emerging disease.
Dr. Lucey, can you give some kind of idea about how this cooperation happens? We have Dr. Al Hajri mentioning the fact that there is a great degree of inter-reaction between scientists and experts within this field. Can you give us some idea about how you and other experts go about dealing with beginning to understand this disease through this kind of global international cooperation?
Yeah, so there are several ways, certainly through the appropriate international organizations, such as World Health Organization, both in the Eastern Mediterranean Regional Office in Cairo and in the headquarters in Geneva. Also through the individual Supreme Councils of Health or Ministries of Health at the respective countries in the Middle East and North Africa, and also in academic centers throughout the Middle East, North Africa, and Europe, such as in the UK. But certainly also in the Netherlands and Germany. They've done a great deal of work and research, particularly virologic, on the MERS coronavirus. The U.S. Centers for Disease Control is always ready to assist in whatever way they can. I know that they were invited to come to Amman, Jordan last May, about 11 months ago, to be involved with the investigation there of the original outbreak that occurred in April of 2012 in Zarqa, Jordan.
Well, Ben Neuman, if you can give some idea, obviously there is a fatality rate in this particular disease, and yet among experts there is a degree of excitement perhaps. The finding of a novel virus, a new virus, it is something of great interest, obviously, and each new virus, do you learn something more about viruses of the past as well, or is everything in isolation at any point?
No, we've learned so much from studying other coronaviruses, and the MERS case really fits in with that, and it really broadens it. It shows us one additional thing, an additional solution to the problem of how to grow in a person and how to cause disease that a virus has come up with. Every virus presents its own challenges, but there's a lot to learn from what's gone on in the past. And these sorts of international collaborations that the other guests mentioned are essential to figuring out what this all means.
Dr. Al Hajri, I mean, there is something, as I said, bearing in mind the tragedy of the number of fatalities that have occurred, but this example of international cooperation that one sees in times like this gives a kind of renewed hope almost for the medical and the research profession totally.
Yes, and we have a very good example of this collaboration, international collaboration. We, as a new disease, our approach is always focused on the public health and also research to help us in practicing our preventive measures for this disease. We managed with the involvement of the WHO to start a collaboration with the Erasmus Medical Center and National Institute of Health in Netherlands. So because they deal with human and animal samples and research, so we established a collaboration of agreement. We started several studies, but the most important study is a national survey for animals in barns in Qatar, plus the workers with this camel, to see the interaction between workers, human, and owners of this barn with the camels, and the previous exposure to Mers-CoV, whether in animals, and not only camels, all animals available in these barns, and also the humans working with them, to assess the spread of this disease or virus among this particular population. And also we have also managed, as a byproduct of this research, to isolate the Mers-CoV from camels in lab in the Netherlands, and also to replicate it in tissue, which is a new hope to facilitate more research in terms of developing screening tests, or even producing large number of viruses to experiment medications, or also to be candidates for vaccines with vaccine-producing pharmaceuticals.
Dr. Neuman, there are protocols in place, obviously international protocols, but coming across a new virus like this, is it sometimes that you have to fly by the seat of your pants, in a way, make it up as you go along in terms of understanding and dealing with such a virus?
So I suppose there are two questions there. In terms of how we handle it in the lab, in the terms of safety, we can treat this the same way we would treat any other highly contagious, potentially highly contagious or dangerous virus. We use the same precautions as we would use for SARS. However, when we're dealing with the proteins, when we're dealing with the actual genome of this virus, there will always be something unexpected there. And this is what we find as we're starting to look. And so definitely you have to adapt and keep moving as you're starting to research these new viruses.
Dr. Al Hajri, are you waiting for something unexpected, keeping an eye open for it?
Well, since we have now more than 2 years since the beginning of this virus, compared to the SARS, historically, it seems that this virus is not very contagious, at least with the current knowledge that we have. Also, the transmissibility of this virus from human to human is not that strong, and that was evident by the investigation of all cases that has been diagnosed, whether in Qatar or other countries, where when we find one case positive, we investigate the healthcare workers and the household and friends for about 50 or 60 people, and thanks to God, so far we didn't find any secondary cases, except in one situation where we found a secondary case that was mild, and he didn't need any medical care. So it seems that it's not that deadly, and there is a bias or over-representation of severe cases in people with pre-existing medical conditions and weak immune system compared to the healthy young adults who might have a mild disease relatively.
Well, at that particular point, my thanks to our guests, Dr. Daniel Lucey, Dr. Ben Neuman, and Dr. Mohammed Al Hajri. And as always, you can add your voice to the discussion online. We're on facebook.com/AJ Inside Story. Or get in touch with us on Twitter at AJ Inside Story. From everyone here, I'm Mike Hanna. Thanks for watching, and goodbye.